Hi, my name is Keely, and my group members are Jacob and Sophia. Today we are going to be discussing the effects of psilocybin, a hallucinogenic found in certain mushrooms, and how the chemical reaction with the brain can be used to treat depression and anxiety disorders.
What is psilocybin? Well, psilocybin is classified as a psychedelic drug that is known to increase connectivity to different areas of the brain. Psilocybin mushrooms are found in Mexico, Central America, and the United States, according to the DEA. People report that they trip when ingesting psilocybin through different kinds of mushrooms that contain the hallucinogen. People start to see visual changes, auditory changes, mood changes, and have newfound insights on themselves, others, and the world. Many studies show that psilocybin's effect on the brain is useful for helping people who suffer from depression and anxiety, as well as addiction. This is all because psilocybin creates new pathways of connectivity throughout different regions of the brain, increasing activity in some areas and decreasing activity in others.
Magic mushrooms are a hallucinogenic compound mostly composed of psilocybin and psilocin. After ingestion, the reaction takes place that converts psilocybin to psilocin. This neurochemical has similar effects to serotonin. Psilocin is very soluble in water and many other compounds. In contrast to LSD, psilocin does not have an effect on the dopamine receptor. Tryptamines and phenethylamine hallucinogens both have relatively high affinity for serotonin 5-HT2 receptors, but they differ in their affinity for other subtypes of serotonin receptors. According to the Johns Hopkins medical study of the brain when introduced to psilocybin, they found that psilocybin reduced neural activity in the colostrum by 15 to 30%. This lowered activity also appeared to be associated with stronger subjective feelings of the drug, such as emotional and mystical experiences. The research also found that psilocybin changed the way that the colostrum communicated with different brain regions involved in hearing, attention, decision-making, and remembering. Research from the study shows the reason why people usually experience effects of the drugs as feeling more connected to nature, others, and their surroundings, and a loss of ego is because of the colostrum, the region of the brain that is responsible for attention and switching tasks, was less active. Research also shows that psilocybin affects the amygdala, which is the region of the brain that processes emotions such as fear and anxiety, is less active. The same study shows the default mode network, a collaboration of different brain regions, also became stable after taking psilocybin. This suggests that it can be used for medicinal purposes in treating mental health disorders such as depression and anxiety by relieving their symptoms by suppressing certain regions of the brain. In a study published in 2016, cancer patients with depression were given a dose of psilocybin. 80% of them showed significant decreases in depressed mood within 6 months. Thus, research on psilocybin and its ability to combat addiction is just as promising. Johnson conducted a study where 15 volunteers took psilocybin to quit smoking. 80% of the subjects had quit their habit within 6 months. In comparison, the drug varenicline, which is considered to be the best smoking cessation drug yet, is only about 35% effective.
Now mentioning the topic of legalization with magic mushrooms or shrooms. Despite all the positive results from these studies, psilocybin is a Schedule I substance under the Controlled Substances Act, meaning that it has high potential for abuse, no currently accepted medical use and treatment in the United States, and a lack of accepted safety for use under medical supervision. This is also according to the DEA. However, Oakland, California, and Denver, Colorado have decriminalized the use of psilocybin mushrooms, and in 2020, Oregon has become the first state to legalize the drug, despite federal laws and regulations. In other parts of the world, some countries have legalized it, and others have not. Overall, psilocybin's chemical effect on the brain may be an effective treatment for people with depression and anxiety disorders. If we could engineer a way to implement safe drugs for those who need it medically, we could possibly solve the epidemic of decreased mental health in America. Not only can we solve anxiety and depressive disorders, but we may be able to look into research to help patients quit smoking or abusing other hard drugs. To conclude, it may be beneficial to find a way to safely prescribe hallucinogens to people as a medical remedy and a natural alternative to mental health medication.
And here's our works cited page. Thank you for watching.